Second. So, good afternoon, everyone. Thank you for joining us today. My name is Medyanik. Originally, I'm a doctor. I'm a pediatrician. Now, I'm working as a regional manager at Polytex Technologies. And Polytex Technologies is a global leader in providing workwear management solutions for the healthcare. And we're working in 26 countries, and we have more than 6,000 installations all over the world. So today, I'm excited to share with you our collaborative efforts with NHS and facility management team in enhancing operational efficiency and sustainability in healthcare workwear management. So this presentation will walk you through the challenges the NHS faced, the innovative solutions that we provided, and the outstanding results we achieved. So let's start from the problem of scrap wastage in NHS. First of all, it costs a lot of money. Secondly, it harms the environment. NHS loses approximately £50 million per year on this. And it also creates about 8,000 tons of carbon emissions per year. So these numbers demonstrate to us why we should find a better way how to manage the scraps in the hospitals. So maybe you're wondering why this is happening. So managing scraps in NHS is a hard manual work. There are a lot of scraps, but always not enough in the right color and size for everyone. So employees keep their scraps in their lockers, forget about them, lose them, mix them with the dirty items. So all of this leads to unnecessary laundry and low hygiene levels. Also, facility managers can't track the usage of scraps and deliver the scraps a few times per day to every department. So let's explore how Polytex Technologies can simplify all these processes and which benefits they can bring to the hospitals. So I would like to share with you the case study from Chelsea and Westminster Hospital NHS Trust. Chelsea and Westminster Hospital was the first NHS Trust where we implemented Polytex machines. And we are very proud of this case study, and now we have just installed on this week the additional set of the machine in the new department of the hospital. So we conducted a pilot project for 3 months in the X-ray department. This department didn't have any machines, so all the scraps were on the shelves. You can see it on the slide. However, other departments used to have another brand machines, but they were also struggling. So the main concern for the X-ray department was the low hygiene level of scraps, lack of availability of scraps for the employees, and no usage control from the point of facility managers. However, for several departments with another brand machines, the problem was that the capacity of these machines wasn't very big. It was only 128 sets of scraps, and facility managers delivered 3 times per day scraps to these machines. Each refilling took them more than 30 minutes. And because this machine have small cells, and in each cell there is a set of garment, facility managers and linen managers also spent more than 2 hours per day just for folding these items, then to refill the machine. So we can calculate 2 hours per day just for folding, then refilling the machine, 30 minutes each refilling, 3 times per day. Also, the concern for the employees about using these machines were that they can't choose different sizes for tops and bottoms. And it's not very convenient, not all of us have the same sizes. So, in the X-ray department, we implemented a small dispensing unit, D200 Pro, small return unit, R110 Pro, and both units are connected to the software Polytex Total Care Manager. We provided the full training for the employees how to use the machines, and for the facility managers how to use the software, how to get all the data, and how to manage everything. So here on the slide you can see the small dispensing unit D200 Pro and its internal system. The capacity of the machine is 600 items of garment, and the footprint is really small because it's less than 1.5 square meters. You can see that if we compare our machine, Polytex, to another brand machine, the internal system is very easy, with big cells. Facility managers don't need to fold the items in a special way. They just refill the machine stack by stack without any folding, the same way as scraps come from the laundry. So the refilling of this machine, 600 of items, takes approximately 10 minutes, even less. Because of the capacity, you don't need to deliver the scraps to the departments more than once per day, even once per 2 days. So it was a big difference. The idea of the machine that employees have a credits, like allowance to take only, for example, 4 items per day, the allowance on the NHS card. 2 tops and 2 bottoms. So the employee taps the card, chooses the item, the color, the size, and then just in 6 seconds get separately different sizes for tops and bottoms. It's an option. So in the end of the day, employees should return the sold items into the return unit, and then the credit will be back on the employee's card. The return unit has a camera inside that takes picture what exactly was returned. So facility management team can be sure that it's not a mop or towel that was returned. So I think it's very important. Also, facility managers get all the data, which items were used, who used this item, who returned, and if employee hasn't returned the sold item, on the next day he or she wouldn't be allowed to take the new items. So let's watch a short video how the system works, and then we will move to the next slide. This is video from X-ray department, made by me, not very professional, but I think very easy to see how it works. So basically he chose different sizes for tops and bottoms, press OK, and then just in 6 seconds when the blue light appears, got his items. So at the end of the day, he will return it into the return unit. The system are closed, so very good hygiene level. And here we can see the results of the pilot project. Now we extended these machines. We got a new contract and also a new installation of the machines. And based on the data from Polytex Total Care Manager, we saw that more than 300 users were registered, more than 300 employees were registered as users for the machines, and more than 3,000 scraps were delivered through the dispensing unit. All scraps were returned into the return unit. Facilities managers spent only 10 minutes per day for refilling for the machine. The availability of scraps was like 100% because our system sends automatically alerts if linen managers should refill the machine. And employees also were happy that they can choose different sizes for tops and bottoms. So everything was amazing. And the main benefits of our software, Polytex Total Care Manager, first of all, that it has remote access 24/7 from any device. Means on the weekends, facility managers can see what is happening, which is very important. So the system sends automatically alerts if the linen team should refill the machine, which sizes, which items, which sizes should be refilled, in which department, in which machine. They get all the data. And I will show you also the dashboard, how it looks like. So the second thing is that the software is based on the cloud. Means if there are any questions from the facility management team or from the linen team, they can just connect to our IT department, and we can connect to the machine and see what is happening. We can even press the button for the employee just to explain, you should press this button, that's it. So it's very easy to see what is happening and to solve any problems if they are. And the most important thing that our software provides all types of operational reports. Means you know exactly which items are the most popular, which items you use more, which you use less, when you use more items. You can see the peak hours report. And all this data helps to predict future purchases, because you understand what you need to purchase for the next year, for example, for the department. Also decrease the inventory level, because you have the scraps only that you use. Here we can see on the slide the consumption summary from Chelsea and Westminster Hospital for the period from January till February. So different colors means different items, and if you take a look, orange color, for example, means medium size t-shirt. And we see that a lot of employees use this item every day. But when we take a look on, for example, the yellow color and its 3 extra large size trousers, it's not the main item, not the most popular. So for the next year, for example, facility managers know they don't need to order a lot of these trousers. Better more t-shirts. So in Polytex, we really try to achieve net zero goals, and we do it in several ways. First of all, because we provide the full control of scraps usage, we can decrease the inventory level and prevent losses. That's why we decrease the amount of textile on the planet. Secondly, because we provide also the control over the scrap usage, we eliminate the unnecessary laundry and we decrease the amount of laundry. Means we save water, we save energy, and we cut down the pollution from detergents. Also, the machine is very space-saving. It stores 600 items of garments on very small space, 1.5 square meters. All the components of the machines are durable and reliable, and the machine consumes less energy per hour than a coffee machine. So basically, facility management team get the full control over the whole cycle of workwear management. They know exactly which items were sent to the laundry, which items were returned from the laundry, to which department these items were sent, who used these items, who returned, who didn't return. For example, how it looks in real life. You sent to the laundry 300 t-shirts, and you can easily see it in the dashboard. It's not something that you can even check. It will be crystal clear. And then on the next day, laundry returned you only 257 t-shirts. So you can just show them the report and say, where are all the items? So it helps you to cut down the bill for the laundry, and it really helps. So to summarize, Polytex Technologies help hospitals to save at least 30% of annual budget because we decrease the amount of inventory, we decrease the amount of laundry. We save time because we replace hard manual processes with automated machines. We make life of facility management team and linen team really easier. And we improve hygiene level, and user satisfaction is also on very high level because they get their scraps in right sizes, right colors, and there is not any concerns anymore. So thank you very much. I'm happy to answer any questions you may have, and you can also try our machine. It's here, so welcome to our booth.
Any questions at all from Maria? One at the back there?
I just want to ask, does the machine come with a database for the facilities team?
Mm-hmm.
You provide them with a database to see all this data?
Yes, of course, and we provide the full training for the managers of the software, how to add users, how to add credits to the users, everything.
So does it show on the machine, or does it just...
No. It has a remote access from any device, from the laptop, from the phone, whatever you want.
Thank you.
Any other questions at all? Okay, thanks Maria. Thank you.